Niger lies on the southern edge of the Sahara Desert in Africa, landlocked between Nigeria to the south and Algeria to the north. It's one of the poorest countries in the world. Most people live in rural areas. They scrape a living off the land, herding livestock and growing the staple cereal, millet. There's just enough to eat, but there's a hidden hunger among almost all the women and young children, caused by iron-deficiency anemia. It's an unseen problem that slowly steals away the body's strength and immunity to disease. Zalika was so severely anemic, she collapsed after she gave birth. She had to spend 2 weeks in hospital.
I was feeling dizzy and my body was dying. I couldn't stand up on my own.
Zalika's just one of the 2 billion people around the world who lack iron, an essential micronutrient. In Niger's rural areas, pregnant women rely on the knowledge of the village birth attendants, like Zainaba, to help them through childbirth. In Turikuki, as in most villages in the west of the country, 3/4 of the women are anemic. It's so common that there's a word for it in the local language. It's lack of blood. Zainaba knows many of the women she visits daily suffer from the problem, but there's only so much she can do.
I still have a pain in my stomach. I'm coughing and vomiting. I can't see and I can't hear well. I'm not eating. I can't taste anything.
Have you been to the hospital?
No. I went there when it first started, but I'm not getting any better.
Without enough iron in the diet, the body can't make red blood cells. In turn, there's not enough oxygen, causing dizziness and extreme tiredness. But even when anemia is severe, the only visible evidence is paleness.
I
can't really tell if someone is actually anemic. You can't tell until they say they feel dizzy, their body aches and they feel exhausted. When you have all this, I've been told the eyes become white and you can be sure that there's a lack of blood. So ahead.
I do want to go to the hospital, but I don't have the money to go. I needed to feed and take care of the children. People like us who feed themselves day by day. How can they have enough to go to the hospital?
She hasn't been well since the baby was born. He was born when there was no food to eat, and we are struggling to feed ourselves day by day. We have no money to go to the hospital.
Niger's beleaguered health services don't reach most communities. This means supplies of donated iron supplements, distributed by the Ministry of Health, don't get to the women who really need them.
Iron deficiency needs a particular strategy because the dose isn't weekly, monthly, or quarterly. We have to give it every day, and it is very expensive. Also, the channels of distribution in the health coverage are both very weak, about 32 or 34%.
Helen Keller International works in Niger. They believe it's local midwives like Fadima who can play a vital role in supplying women with the extra iron they need. In the western district of Terra, Fadima has the responsibility for handing out iron folate tablets in her village.
Before we started, women were not feeling well. One day she would be standing, the next she wouldn't be able to get up. The women couldn't eat. They didn't have enough blood to make them healthy. I was told to distribute only to pregnant women, So even if I lack blood, I'm not allowed to take the tablets. Even in my house, there's a girl who is the same age as this girl who is 16. She's always eating, but she still hasn't got enough blood.
You're really just scratching the surface of the problem with pregnant women, because obviously the problem in a country like Niger is that women are going into pregnancy anemic. During the adolescent growth spurt, the levels of need for iron are extremely high. They go up dramatically. And girls marry very young here, often 15 or younger. So you're starting this vicious cycle that girls are anemic. They go into their first pregnancy anemic, and they continue, and they never recover between pregnancies.
It's early days. Just 1 in 10 women benefit from this new village-based distribution scheme. To improve on this depends on more people like Fadima, who take her work seriously.
The tablets have been brought for pregnant women. Any pregnant woman can come, and we count out 30 and give them to her. The pregnant woman feels better, and so does the baby. And when it's time for the woman to give birth, it will be easier.
Since 1999, the government has organised micronutrient days for the whole of the country, twice a year. Launched by the head of state, Tanja Mamadou, they are much publicised events aimed at increasing awareness about the importance of good nutrition across the country. But this year, the essential role of micronutrients in the diet has been dwarfed by food shortages.
There's been shortage in Niger this year, and we know the most vulnerable are mothers and children. The government has taken charge by providing the population of Niger with cheaper cereal, to the mother and child in particular, so that this section of the community will be saved from the situation in which we are living since last October. And thanks God, the program from Bilma to Terra has helped, and as you see, there are no image of emaciated people, and the mother and child haven't been forgotten.
In Terra, families still hope for rain as they continue to plant this year's millet crop. Millet is their staple diet, but it's this diet that contributes to anemia.
The basic diet is cereal-based, and cereals have phytates which inhibit the absorption of iron. So you have, that's one of the fundamental problems. Animal sources of iron, such as meat or especially liver, are very good, but herds often are seen more as a capital than something you consume on a regular basis. Even if you are going to eat meat products in a family, who's going to get them? And traditionally, men are going to get the choicest portions. And so the actual amount of, for example, liver that will get to women or get to children is relatively low.
Gopto is a meal eaten every day in Terra district. This is what Fadima and her family are eating tonight. It's millet, a little flour mixed with oil, salt, and green-leafed amaka.
Meat. If we do have meat, it will be a while before we have it again. We eat it about 3 times a month. We share it out with everyone. It is expensive. 200 West African francs buys enough for only a little piece each.
Anemia in pregnancy almost always leads to mothers giving birth to low birth weight and anemic babies. These children are especially vulnerable as they lack the strength to fight off disease. In Niamey's pediatric hospital, Dr. Burema sees 3,000 malnourished children every year.
It's the same problem. Completely malnourished. She is both malnourished and anemic.
Nous savons que l'anémie, c'est la 4e.
We know anemia is the fourth cause of hospitalization in the service in terms of numbers. There are the severe cases, but practically all children who are suffering from malnutrition are anemic as well. Plus, the other causes of anemia, whether it's malaria or severe infection. This department in the hospital is the one which uses the most blood.
Qui consomme le plus de sang. C'est blanc, hein?
It's very white.
C'est tout blanc. Il a l'anémie chronique.
He has chronic anemia, and if he's got malaria, as malaria is a cause of anemia, the anemia becomes worse, and this can kill him. You understand, the cause of death is not anemia, it's the malaria that kills the child.
C'est le même problème.
It's the same problem. Very, very white. What do you know about lack of blood? How do you know if you have anemia?
Yes, lack of blood. If it's not yellow fever, it means your body is lifeless. It is as if the body dies.
We know that anemia affects the intellectual development because not enough oxygen is transmitted in the nervous system and in the body's tissues.
Helen Keller International and the United Nations Children's Fund, UNICEF, are the main contributors to the National Iron Supplementation Programme in Niger. Even so, the majority of women and children, 6 out of 10, still miss out. One problem is that the government hasn't allocated specific funds for nutrition.
In all the species, you hear people saying nutrition is a priority. But in practice, when you look, you can't see allocation of the budget for nutrition. It is said it is a priority, but the resources don't reflect that this is so, whether it is financial or human resources.
Pour tout le Niger, il y a moins de 10 nutritionnistes formés.
For all Niger, there are less than 10 qualified nutritionists. In other words, the need to promote nutrition for human development has certainly not really been recognized yet.
Fatih lives in Aviation on the outskirts of Niger's capital, Niamey. She's 8 months pregnant and has malaria. Malaria is one of the major causes of lack of iron in the body. After Fatih was bitten by mosquitoes, the parasites in her body started destroying the red blood cells and caused severe anemia. Fatih's baby will also be deprived of iron.
I've been to the hospital and I had some blood tests. It cost me 7,500 West African francs, and they told me that I lack blood. Look at my hands and my eyes. I'm dizzy, and I can't stand for long when I'm dizzy. It always makes me vomit. I find it difficult to stand up on my own. When I went to the maternity hospital, I met many women with the same problem. They all complain about malaria. At 7 months and 15 days, my son died in my womb. I was very sick at that time. Yes, like now.
It's a vicious cycle. Malaria causes blood loss. Then the body, weakened to infection, can't fight off malaria when it returns. On the other side of the continent in Tanzania, anemia is getting worse. The coastal region from Kenya in the north to Mozambique in the south is a malaria zone. Anemia affects almost all children under 5 in the 82 villages in Bagamoyo district.
One week it's the mother, the next it's the child. You can say that this is the biggest disease that we have here, this malaria. It's a big problem because sometimes a person is told month after month they have to go to Mwimbili hospital.
And here it's difficult to get out of this village every day to go there and get checkups.
Malaria kills one child every 30 seconds. Those that do survive are more susceptible to recurring bouts of infection. In neighbouring Wanamakuka, school teacher Fatuma Matamba sees the effects of malaria daily.
They become very weak, and even in class, they can't concentrate because they are tired all the time. And in class, the brain becomes slower and slower, and they get worse every day. They can attend for 3 days, and then they're absent for 2. Sometimes they attend in the morning, but then not in the afternoon because they are so weak. Because of the malaria, they become anemic, and then they get malaria again. So they don't attend daily lessons properly. And if they don't attend lessons, they lose their intellectual ability.
The Tanzanian Food and Nutrition Centre is working with the 4 health centres in Bagamoyo to try and replace the iron lost in children due to malaria.
We are intervening, we are giving children below the age of 5 years, iron syrup, and we are deworming them using mebendazole. And we will follow them up to see if there's going to be any impact. The children must go to a health unit, in order to get these supplements and the deworming drugs. So if the child doesn't attend, it means it's going to miss the next provision of the supplement. But you find that the number of children that attended last month has dwindled, has gone down. Sometimes the drugs may be there, but the health worker does not know that he or she should prescribe this.
There were some tablets that were given for a week, but other people got them. I don't know what the tablets were for. The children were given syrup in a bottle to drink from 1 week to the next, Friday to Friday. That's what they gave the children, and that's what I gave my children. But I didn't know what it was for.
There isn't much awareness. And partly this is because the health facilities, especially in the rural areas, do not screen the women. Because if we were able to screen the women and tell them what their hemoglobin levels are, then that is an opportunity also to explain what anemia is and what they can do about it. I think the strategy for control of iron deficiency, especially in women, has been really hospital-based or health system-based. So that assumes a real working health system, the primary, especially at primary health care level. But as you know, our primary health care system is not working.
Differing views among health scientists have left iron deficiency control programs floundering, unable to provide clear guidance.
We tended to believe earlier that in areas where malaria is endemic, that iron supplementation may in fact increase the risk of malaria. Now we know otherwise, that is not the case. And so we need to pursue the iron supplementation a little bit more aggressively, but at the same time we've got to deal with malaria in a different way as well, preventing malaria.
In Kiboyuni village, Bagamoyo, Mitamar's unusual. She bought a mosquito net when her first child was born, 19 years ago.
To buy one now, it is 3,300 Tanzanian shillings. I don't have that money. I live by farming. I dig cassava to feed my children. If I sell the cassava, what will I feed my children with? How can I buy a net? This is my net. This is where my children sleep. 2 on this side and the other 2 on that side. I cover them, and these are the parts I've repaired.
as long as the children don't get bitten by mosquitoes. The children are playing all day. In the evening, after they've eaten and been washed, if you put them to bed, they will be so tired they can't feel the mosquito when it bites. But me as an adult, if I feel anything, I just hate it. No, I can't afford to buy another net for my husband, myself, my children. My income is very low. I have to struggle with this one just for the sake of my children.
So long as poverty reigns in this part of the world, all these problems will continue to be afflicting us. Poverty alleviation first, and then supplementation as short-term measures can just be sort of stopgap measures, you know.
In the short term or even in the medium term, we don't see diet alone as sufficient in terms of improving iron intakes, and so supplementation is something that will probably need to be continued on a medium term, if not a long term basis.
Iron folate tablets have been distributed to mother and child clinics in Tanzania since 1974. But there's been almost no progress in reducing the rates of anemia.
Iron is a much more complex problem. It's a problem that that policymakers and programmers themselves, until a few years ago, have not been very clear about what to do. And perhaps that is one of the reasons why we haven't made as much progress with iron. We haven't necessarily focused enough on adolescent girls, for example. And those adolescent girls are a very, very critical group as far as iron supplementation is concerned. As far as anemia, malaria, and iron supplementation, all three of those are concerned.
In Tanzania, 16% of pregnancies are women under the age of 18. Teresa Idiva sees many young mothers daily at Mbagala Clinic in Temeke, on the outskirts of Dar es Salaam.
We are trying our best to make sure that these young mothers, we take time to talk with them, so we have to screen them, we give them health education, how to take care of their health, their nutrition-wise, and so forth. You know, these pills, although we are giving the mothers, we are not sure if they are taking the pill, because you can check the hemoglobin at this month, then at the second visit when they come, you can find the hemoglobin maybe lower than the previous one. Now you ask the mother, did you really take these drugs? She says, oh no, when I took the drug I vomited, you know. Oh, I feel abdominal discomfort.
Iron is not well tolerated by the body, particularly when it's deficient of other micronutrients. It's another problem to overcome in finding solutions to prevent iron deficiency anemia. It's also going to take a big education push to promote good nutrition and the importance of eating iron-rich foods before the rates of anemia go down.
We have a problem of sustainability in our country and in many developing countries. Sustainability. You find a project like this is supported from outside, and it's short-lived. So when these supporters pull out, you find the country is not ready to take over.
In many governments, nutrition is sort of something that falls between the ministries of health. Sometimes it's the Ministry of Planning, sometimes it's the Ministry of Agriculture. In the case of Tanzania, it's the Tanzania Food and Nutrition Center. So it's something that falls between all of these ministries, and in the process, nobody really ends up allocating enough resources for nutrition.
For about 15 years now, we have been implementing structural adjustment program under World Bank and International Monetary Fund. Before that, the funding for social services in this country was a bit better. But from that time, things have become worse and worse. Social services are not funded. And we are servicing external debts.
That's the problem. So with cancellation of debts, we think that we'll be able to put more funds into health services, including nutrition, and we should be able to sustain some of these projects which we are initiating.